Namaskar and welcome to Apollo 24/7's Health Hour. Health Hour is a show which brings you experts from Apollo hospitals every Sunday to a live show. In this live show, from now on, we are expecting you to join us and ask your questions and queries that you've been postponing to ask. So this is your chance to come on to the live show and definitely ask questions. And you want to ask the question, please join us on YouTube chat, because you must be watching this on Facebook and Instagram as well. But if you want your query to be answered, we would want you to hop on to YouTube chat and type your question there. I shall post it to your to our expert today. And on the show, we are going to give you discount vouchers and gift coupons as well. Stay with us towards the end of the show when I give you the discount vouchers. And also, there's a health quiz coming up where you can win prizes from Apollo 24/7. Today, we are going to talk about a very different and a difficult topic. We are going to talk about unexplained symptoms. It's not just in your head. Psychosomatic. You experience the pain, but there is no reason for it. What is the reason for this and how do you treat these? Let's understand psychosomatic disorders. Today we are going to have Dr. Shrilaxmi Velandi, who is a psychiatrist from Apollo Hospitals, Chennai, who has more than 20 years of experience, and she can be consulted for adolescent medicine, marital counseling, cognitive behavioral therapy, family counseling, stress management, and premarital or marital counseling as well. Obsessive compulsive disorder, that is OCDK treatments also. So today we have our very esteemed guest, Dr. Shrilaxmi. Good morning, ma'am. Namaskar.
Namaskar. Namaskar. Good morning.
Yes, ma'am. How have you been, ma'am?
I'm well, thank you. How are you?
Thank you so much, ma'am. So, it all boils down to how well we are. And that's exactly your expertise, that's your field of medicine, that you take care of our well being in absolutely true sense.
That's true, and I think it's a joy to do that. And I think people, like you rightly said, it's both about the emotional as well as the physical well-being. And like you rightly said, we can't separate the one from the other. And I think that's the joy of perhaps psychiatry.
Absolutely, ma'am. So, ma'am, before I start, I see a lot of people are joining us on the YouTube live chat as well, and they are asking questions. But let me start to explain what we're going to talk about. So, psychosomatic issues or disorders. This sounds really very difficult and a very big term. But to break it down and simplify, there are symptoms, there is pain, there is a lot of anxiety related issues, and which are appearing on the physical level, but there is no reason for it. That if I go get a battery of blood tests done, there is everything perfectly normal on my report, but I still have symptoms, I still have pain. This is what psychosomatic is. Please correct me if that's a right definition, and if you can please guide us with the right terminology.
Definitely, ma'am. Absolutely. And I think you're spot on in with your description. So quite often people are present with various different symptoms. So there may be headaches, tummy aches, what appear to be seizures, episodes of loss of consciousness, various movements of the limbs, of the body, which are very disconcerting. It's very anxiety provoking when you all of a sudden have symptoms that you can't, and when your mind is that uh, all the tests are fine, all the reports are fine, and because there is again the kind of difficulties that they are experiencing. So they often hear maybe medical professionals saying things are all fine. And I think rather than people being happy that things are fine, they are left with feeling very bewildered because they don't know what's going on. So, and sometimes tends to happen is that the brain influences, or the emotional aspects of the brain influences how the body behaves or how the symptoms present. And these are called by various different terms. So, some of the classificatory systems that we use, the International Classification of Diseases, or ICD, is what we call emotional or diagnosing emotional health conditions. And as part of that, they have either conversion symptoms, functional disorders, various different types of terms are used, medically unexplained symptoms. And I think that can be very challenging for people, as anybody can understand. You know, people go to doctors for a solution, and then what they hear people saying is that everything is fine, but they are still left with the symptoms, which are very intense, very painful. So, how do you deal with it? How do you manage it?
Exactly, ma'am.
So, that
I have
becomes
a
very
very good
difficult.
friend, a very, very close friend, who's just turned 50, and she has been having so much of tachycardia, palpitation. She feels as if she has, tightness in her chest, as if onset of heart attack, or some kind of cardiological problem. She has visited, you will not believe, ma'am, n number of cardiologists in the city. She has gone to US. She has visited so many people, but nobody has found any problem with her heart, respiratory, or leave alone anything else. Everything points out saying that no, you're all fine. You're just having it. You are imagining it, and they have. But when I suggest her, why don't you actually look at a psychiatry or a psychological angle to their relief? She says, no, no, this is not psychiatry. This is not psychology. This is nothing related. I am having pain. So this is such a difficult. How do we help such people, ma'am?
Oh, absolutely. I think, like you rightly said, an important thing for us to remember is that it's not imagined at all. In no way is it imagined. So when people say it's all in our head, that's not true, because the symptoms are actually happening. People are
Yes,
experiencing it, and it isn't happening just in their head. That's absolutely not true at all. So what tends to happen is, now, quite often when I think with children, I give them an example brain as a classroom. So the front of the brain, this part of the brain, is called the prefrontal cortex. And that's the part which is responsible for planning, organizing, insight, managing the rest of the brain. So it, like a teacher would manage the rest of the classroom. So all the other parts of the brain are managed by the prefrontal cortex. Now, when a person is under a lot of pressure due to various different reasons, sometimes we are aware of the level of stress we are under, sometimes we are unaware of the level of stress we are under. So sometimes when that happens, the prefrontal cortex shuts down. And I'll tell you a bit more about that as we go on. And I think it's not functioning adequately. It's as if the teacher is out of the classroom. So you can imagine what happens when the teacher is not in, isn't it? So there's absolute chaos. There is no coordinated work. There's no organized work that happens. There is no planning. So what then tends to happen is that the different parts of the brain are functioning in their own way. They take up
exactly.
their own aspect. So, which then means parts of the brain which shouldn't be causing movements cause movements, parts of the brain which shouldn't be causing increased heart rate, blood pressure shooting up, does that. It causes pain. So, the different pathways which carry pain from the different parts of the body to the brain, and then the pathways from the brain to the different parts of the body become absolutely amplified. So there is a dialing up that happens. So the person is definitely not imagining it. The pain is absolutely there. Increased heart rate is absolutely there. But the cause for it is not in the body, but it's in the mind and the brain. So it's
So here,
about,
yes, ma'am. Please continue, ma'am. Please continue.
I was just saying, when we try and think about strategies to bring the teacher back into the lesson, that's what we tend to do. So we try to look at how do we make sense of this. And again, like you rightly said, the fear about going to a psychiatrist or a psychologist is massive. But I think
Yes.
psychiatry is just like any other specialty. It's not that a person has a severe and enduring mental health problem which is not curable. You know, there
Ma'am,
are
it's okay.
very
You have a severe mental health problem. Why? There's so much of stigma associated with it. There's so much of trauma or social pressure that is associated with going to a psychiatrist. This should be resolved first. First and foremost, that we need to talk to ourselves. Our society should be conditioned that it's okay. Your mental health is priority. You must visit a psychiatrist or a psychologist. So, coming back to my friend's case, a lot, ma'am, quickly to our audience, dear audience, you have joined, and a lot of people are asking about other issues. I don't think we will be able to answer issues which are relating to other organs or other medicine fields. Today, we're going to remain with our psychosomatic topic only. So let me continue, ma'am. So, ma'am, as I was talking to you about my friend who does not want to talk to a psychiatrist, but she still feels that she is very strongly having some kind of problem. She's conditioning herself that she has a problem. So, and also there is a stress at her home level, which we understand as third person. So, do you think that reducing the stress, reducing anxiety, or any other issues that are disturbing her will help her?
definitely, absolutely, definitely. So I think what we try and think about is if is a close, like you said, seems like she has a very good relationship with yourself. You know, spending time with yourself, thinking through what is going on. Doesn't need to be a professional if she's anxious about seeing a professional. So it's trying to then work out what is stressful in their life at that point in time. Can I work on that myself? Are there strategies that I can use? There are a lot of self-help that can be. So it's then trying to think about um, and affect them, and how they kind of an understanding within themselves of what this is about, because that takes time. And like you said, it um, we find when people run from pillar to post, visit a lot of doctors without getting anywhere. That can be quite frustrating, quite disconcerting. So it becomes
Yeah. All right. So, ma'am, your voice has been breaking in between. So, please do not mind if I ask you to repeat your answer once again. So, next time, this was at least understandable. Ma'am, one quick question. Will anxiety and high stress conditions cause psychosomatic? Are they directly related? Or do stress or anxiety aggravate psychosomatic? What is it, ma'am? Which is the first cause?
So that's a really helpful question, ma'am. So I think you're absolutely right. The cause is the stress. So for
Acha.
any kind of functional medical symptoms, when we use the term psychosomatic illnesses, that's a very broad term. So just as we were talking, the mind and the body are closely related, and we can't separate the mind from the body. So, example, chronic conditions like diabetes, hypertension, they are influenced by the amount of stress there is. So, in that situation, blood sugar being affected, blood pressure being affected by stress, poorly controlled diabetes, poorly controlled blood pressure, all that can be aggravated or caused by stress. Whereas what we are talking about, this group of illnesses, the direct cause is the stress which is causing these symptoms. There is no other cause for it. So, for example, we often find anxiety disorders, depressive disorders. When a person is present with multiple somatic complaints. So they may have pains in their limbs, they may have difficulties where they lose consciousness, they have episodes of fainting. It's absolutely, and sometimes people have such incredible movements of their limbs where you think, how possible? How can this not be epilepsy? That's the extent that the mind influence these physical symptoms because the mind and
Ma'am,
brain
sorry, your audio
are
is breaking. Uh, I couldn't grab the last sentence. So, the last sentence, if you can repeat, ma'am.
absolutely. So, what I was saying is, those stress can aggravate some chronic health conditions like diabetes and what we are looking at is here the medically
Okay, ma'am.
unexplained symptoms of functions consequence. Sorry,
Not able to hear you completely, ma'am. So it would help if you can please refresh the link once,
yes,
or just try. Now you have released from the frozen position. So yes, let's try.
sorry.
All right. So in the meanwhile, while
Sorry.
Dr. Shrilaxmi, ma'am, are you there with us, ma'am?
I I am,
Yes.
I am.
Ma'am, here's a question from one of our viewers. Bhanu Prakash. This is a psychiatric question, ma'am. I'm not actually relating to psychosomatic. Uh, yeah, ma'am, for generalized anxiety disorder, I've been taking a certain tablet called paroxetine CR since 3 years, 6 months as doctor's prescription. Initially, I had high palpitations and sweating in the palms, soles, and I had insomnia also. Do I have to continue these tablets? How long? I'm feeling the tightness of chest while sleeping in the night.
Uh, Thank you for the question. Thank you for the question. Paroxetine is a medication which is used for anxiety disorders. And depending on how long the symptoms have been going on for, the duration of treatment depends on that. So sometimes it can be for around 6 months, some can be for
Ma'am, your voice is,
a while.
ma'am, sorry, I know that this is very important answer, so your voice is breaking. Sometimes the symptoms can be, we continue.
Sometimes the symptoms can last a bit longer. So it's worthwhile just going back to your psychiatrist. Say if the symptoms are not completely settled, it might be worthwhile medication optimizing the dose or is medication working for a period of time. Those are the kind of things to consider. And it may also be helpful to try and think about certain psychological treatments alongside the medication as well. So, strategies like cognitive behavior therapy are extremely helpful, which means that you're learning strategies to manage those anxiety symptoms alongside the medication, which is really great because while your medication and when you're coming off the medication, those strategies can help in the longer term. So, research evidence suggests that a combination of both medication as well as psychological treatments really works for people. So, there are three main things: optimizing medication, seeing if that the medication is the right one, thinking about how there are some side effects with the medication per se that needs to be considered psychological alongside medication. These are all aspects
Yes.
that I've seen.
Yes, Bhanu Prakash, yes, man's voice was breaking. You cannot hear. So I have made notes of what Dr. Sri Lakshmi has just told. Ma'am, please correct me in case I'm going wrong. One is that you need to go back to your psychiatrist to optimize your medication level and also seeing that the right medication is being given. Sometimes it might take a longer time to manage your symptoms, and knowing information or being aware of the side effects is also important. Please do speak to your psychiatrist. And having a CBT, that is cognitive behavioral therapy with psychologists alongside with your treatment, will help you manage your symptoms. This is what condensed answer from Dr. Srilakshmi was. Bhanu Prakash, I hope that was clear, and do go back to your psychiatrist. Ma'am, did I go wrong somewhere, ma'am, or is that right, ma'am?
Not at all. Not at all.
Yes,
It
ma'am.
was absolutely
Sorry,
fine.
ma'am, for overlapping
Thank
your
you.
answers, because I wanted the right answer to reach out to the person who's been asking. Bhanu Prakash has also typed that he has reduced the dosage strengths with meditation and pranayama. So, did you do this,
That's
Bhanu
a
Prakash, on your own, or was this also your psychiatrist's consultation? So, ma'am, meditation, yoga, pranayama. In the meanwhile, till the time that Bhanu Prakash replies, are these also equally important alongside CBT and psychological issues, ma'am?
It's big, it does. I think one thing that really helps, and you're absolutely right, you were saying, um, it helps to any medication increases, dosage reductions is best done under medical supervision or medical guidance. Yoga, pranayama, those aspects really make a difference. So
Yes.
there's not enough research as much as we'd like, but there is still enough evidence to say that yoga makes such a difference in terms of management of stress. Definitely, without a doubt.
Right. So Bhanu Prakash has answered that this was reduced as per the psychiatrist's suggestions. So that means meditation and yoga have helped.
Absolutely, absolutely. That's
So,
really great, Mani Prakash. It seems like you're working really hard on matters. Um, and I can see how keen you are to make sure that you're on this journey to recover. And I think a lot of it is the amount of effort that people put in alongside the medication. Absolutely.
appreciating you, Bhanu Prakash. Congratulations, and keep the good work going. And this is how we need to take care. I think here self care comes priority, ma'am. Wherein anxiety is something that किसी को बोल के नहीं आता है, and you don't even know what is affecting us, what kind of situation can put us through these anxiety issues. So next question that I would want to ask is from Mr. Vishnu Kondapalli. I'm feeling as if I'm unable to do any task in my life. So I was late in many things when I compare with the society's pressure. How can I overcome this kind of mindset? Please give me a valuable solution. So I think this is again a classical, putting yourself through pressure of society's norms.
Definitely. Mr. Vishnu Kirtan. If I've understood the question right, it's about social pressures and how people are trying to keep up with it or manage different ways. And when we look at it, maybe various different reasons for it. So it's trying to understand what is actually causing that. So
Yes.
some people might find that they are very keen to do things really right. Sometimes we find people who are perfectionists by nature, so they want things to be really perfect. So, which means that anything which is less than perfect makes them very anxious and uncomfortable. So, as a consequence, they tend to put things off to a certain extent because whatever they do, they want it done really great. So, which then means that there is an added pressure on themselves um, on themselves. So it's then trying to look at how do we ourselves, how do we understand that within ourselves. And I think these are kind of things that we can. So because there are so many reasons that one we may not be able to do the kind of things we really want to. So we are really motivated, but we find that we are falling slightly short of what we want to do or where we want to be. So it's then trying to make sense of what is getting in the way of that, understanding ourselves a bit more. So, is it anxiety that's getting in the way? Is it who we are as individuals? How do we make sense of that? Those are kind of things that will be really helpful to think through with somebody. And I think this is where, we get a bit anxious of going to a psychologist or a psychiatrist. But these kind of aspects may take a couple of sessions. You may see somebody and you may think, I've got it now.
Yeah,
This is clearer to me now. Um, so,
absolutely. Also, Vishnu, if I know, I've because Vishnu Kondapalli has been a regular viewer on the show. I've seen his interactions earlier. Vishnu, there are small victories that you can celebrate and never pressurize yourself with other societal norms that you won't want to compare. You have done great. If I remember the weight issues that you have battled with for all your younger days, you have reduced beautifully, and that's a great victory. Go ahead, celebrate. And as Dr. Srilakshmi has suggested, it's okay to go consult and have a therapy session. See where you are doing good and see where you can even better yourself. That was a sincere suggestion. Go ahead, take a few therapy sessions. We will leave Dr. Srilakshmi's link in the description box, and also we do have a panel of psychologists on Apollo 24/7. You would want to take a appointment. We will leave links in the description box as well. Ma'am, next question that we would want to take is Mr. Vijay Sharma. Vijay Sharma ji ka age है 38. Oh, Vijay is 38, female, weight is 70. She feels giddiness very frequently, and any blood tests that they do, there's not much of description there. So when there is absolutely something which is physical, what are the first things that one should rule out, and when should we come to a conclusion that this is psychosomatic?
Thank you. That's a really helpful question. And thank you, Ms. Vijay, for question. That's a really helpful one. So, usually, because giddiness is by so many different conditions, it's making sure that your blood pressure, basic physical parameters are okay. When a person is anemic or their hemoglobin is a bit low, they might feel a bit giddy. There is a possibility that other physical parameters, thyroid related vitamin deficiencies, those aspects can also cause a bit of giddiness. So it's making sure that you have a baseline blood investigation, a baseline physical health check before we come to the conclusion that if all that is fine, about what, So I think that's a really helpful question to ask because it's think about we ourselves tell ourselves, don't we? Under stress, and this is what is possibly causing it. Rather than coming to the conclusion ourselves, it's about making sure that we seek medical advice, we make sure that based
Yeah.
about,
Ma'am, your voice is broken up a bit a little while ago. So let me get what I've heard, and then you can continue from there. So first, you said that we should rule out certain blood work karna hai, where you can rule out if you're anemic, thyroid, hypertension, diabetes, and something else that you did mention, that you need to rule out these basic physical illnesses. And these packages are available on Apollo 24/7. You can book their lab tests, which are a physician recommended basic lab test, and once they have ruled out that everything is fine, all the parameters are fine, that's when they should think of psychosomatic, right ma'am? That's what I was hearing. I think ma'am, you're frozen as of now. Dear audience, absolutely sorry. Dr. Srilakshmi is
that's
coming in from, yeah, yeah, sorry ma'am, beach mein you got frozen, so
यहाँ पे नेटवर्क उतना अच्छा नहीं है शायद.
that's what
I'm
I've
so
understood,
sorry.
ma'am. But thank you so much, all the way from Chennai and remote. We understand that you have given us valuable Sunday morning. I'm trying as much as repeating your answers so that at least
Thank
people who are watching us will be able to get their answers. Yes, ma'am. So, Mr.
Absolutely.
Vijay Sharma ji, you should go ahead, get your blood test first done. and then there's everything is normal there, please consult a psychiatrist or a psychologist. Is that the answer, ma'am?
The medics will be able to, and I think if there are things you feel stress that's going on, thinking about, which is a bit difficult. So it a band rather than an either or.
Ma'am, this was very
So
badly breaking up. I couldn't
you could
place what you were saying, ma'am.
do
Um, right now, I just see you frozen on the screen and not even bits and pieces of audio that I can hear. But if you are able to hear me from your end,
so.
we would request you to refresh the link once and join us back onto the show, ma'am. If you can just log out and log in once, yes. Yes, dear viewers, this is very difficult situation where you have symptoms, you have pain in, or you have palpitations, you have stomach ache, especially children. I think we will move on to the section where once Dr. Shrilaxmi joins us back, we will move on to children who complain of pain, who complain of stomach aches. They do complain of limbs which are aching, body aches and headaches, and you will find that there's nothing, no cause, and you don't believe children. This is again a very very important segment of people who have unexplained symptoms, and all their test reports would be normal, and we as adults do not want to believe. We think that they don't want to go to school and they are making up these stories, and we would want to push them. So if you have any such questions, or if you have heard of any such cases, please do come up onto YouTube chat and type your question. We'll be able to help, because Dr. Srilakshmi Velandi from Apollo Hospitals, Chennai is a psychiatrist and specializes in pediatric psychology as well. We'll be able to answer them very well too. So, yeah, I see Mr. Rohit, आपने SGT and SGOT and SGPT के बारे में पूछा है. This is not the platform where we can answer. But if you want any other liver related solution, we have done an episode हाल ही में किया था हमने. Please go ahead and check the other episodes where you might find an answer too. All right, and somebody's father who had gone through a brain hemorrhage and feels giddiness. I'll take your question up very soon. Now, that question was asked very beginning of the show itself. Manish Kumar, I will ask your question in a bit once ma'am joins us back. Manu Prakash, your answer is answered. Your question is answered. Yes, your breathing exercises have helped. I'm so glad. He has reversed his diabetes with basically his diabetes is remission into remission with diet control as well. Wonderful. These are those victories that we all should celebrate, learn from each other's successes and wins, and then share these with the. Okay. So, Mr. PJ Hari. All right, you have hypertension and going through tension headaches. Definitely, we will take this up, Mr. Hari. We will take. Okay. Then also, yeah, Dr. Sri Lakshmi has just logged in again. We are waiting for her to come back onto the show. We will be able to answer your questions. But any kind of physical pain that you are having, or anything that you do not think that this is only one ailment, do get your examinations done, lab reports done, and if there is nothing there, do not give up. There is a psychiatrist, there is an entire department which can help. This can be stress related, this can be anxiety related, so there is an entire department which can take care of your because there's no need of suffering from issues. Yes, Dr. Sri Lakshmi is back on the show. I can see her smiling.
I'm so sorry. I'm really sorry. There are technical issues at my end. The network isn't
No
great at all.
problem, ma'am. No problem. We've been waiting, and I've just been going through the questions, ma'am. So yes, we were answering last answer where when to get an assessment with a psychiatrist.
Yes, yes. And I think, especially like you rightly said, if there are physical symptoms, it's important not to ignore all the physical causes that could be causing those symptoms. That could be the main reason. So it's then trying to work out what is physical, and there may be psychological factors which are associated with it. It can be both and, rather than thinking either or. So I think it's helpful to consider both. And I think there are certain self-help strategies that people can use as well. So it's not that we need to go to a psychologist or a psychiatrist each time. So it's trying to think about what are those basic self-help strategies, and we are working on maybe leaflets that people can access. There are some breathing exercises that people can do, having an understanding of what are the main things. So certain very subtle lifestyle changes, and like you were saying, Jansi ma'am, it's about trying to prioritize ourselves, thinking about things that we enjoy in the day, trying to make time for ourselves, even if it is 5-10 minutes, thinking about going for a walk, spending time with a friend, having a cup of coffee. We talk about mindfulness. There are a lot of strategies that are out there which try and think about how we can help us focus on ourselves and give ourselves that priority. And it doesn't have to be a long time. It's just 10-15 minutes in the day. And those are kind of strategies that each individual can do themselves, rather than thinking about, oh dear, I need to go to a professional.
Yeah.
Yeah.
Yeah. And everyday management of stress is something, your response to stress is something that one needs to learn. Your own defense mechanisms and strategies from your own life, these are something that we all have to apply. Yeah. Ma'am, here's next question that I would want to place before you. Mr. PJ Hari. He was prescribed for tension headaches, BP tablets, Samitone and Stamlopam for 2 or 3 months by a neurologist because he was going through tension headaches from last more than 10 years. After taking the medications, he was I'm doing very well in rational thinking and living normal life without any fears. But once the course is over, then again I'm suffering from fears, anxiety, frustration, anger, sadness, and mood swings. How long should I take these hypertension medications? Can I not become normal like in my good old days without relying on pills?
Thank you so much. That's a really, really helpful question, and thank you for logging in today. Seems like I'm sorry to hear that the difficulties have been going on for quite a while, and it's not easy managing with that level of that intensity and that duration of symptoms. It becomes very challenging to manage it.
10 years.
Now, and I can also see that you're having mood related symptoms, some anxiety related symptoms. In this situation, could I please suggest that it may be a good idea to consult a psychiatrist? The only reason I'm saying that is the length of symptoms, the duration of symptoms, and the intensity of symptoms, and there is something that we can really do to help it. And it seems like you're on a range of different drugs. It also helps to optimize. We often talk about optimizing medication. We often think about, if there are a few medications, is it possible to, fine tune it rather than you having to take so many medications? And that's where, when two clinicians, because the brain comes with different aspects, isn't it? The mind and the brain are so part of each other that it becomes difficult to separate it. In this particular instance, my suggestion would be to talk to somebody to try and make sense of what is going on, so that we can rationalize the medication a little bit, think about whether certain other drugs might be helpful rather than the ones that you're taking, and whether some amount of psychological help will also make a difference alongside the medication that you're taking, especially with tension headaches.
Ah, ma'am. Ma'am, I also can I add something here, ma'am? I used to have a very, very dear friend who was a very famous actor and who had panic attacks. On the set, we used to see that he was very, very anxious, and we had to rush him to a hospital thinking it was something really very emergency situation, but turned out to be a panic attack. And the same person, who's a very well known actor, did not want to continue his medications of psychiatric medications, thinking that these are going to damage his career. And the fear of taking medications is for real, ma'am. He can deal with all the anxious tension headaches and panic attacks, but he doesn't want to deal with the side effects, or the psychiatric medicines. Why is there so much of stigma around it?
Oh, that is absolutely right. Thank you for talking about your friend. I think what tends to happen is there's a lot of fear. People have
Huh?
seen um, medications causing sometimes perhaps harm, but uh, it's trying to think about medications with the right dosage at the right time with adequate support makes a phenomenal difference. So it's
Yes.
not that medications have to be taken for life. The earlier we seek help, the better it is. Because what we find is the duration of treatment then is a lot better. People try and manage symptoms very effectively very early on, so you don't have to stay on medication for life. But there may be certain situations where long term medications are needed. For example, like diabetes, hypertension, where we can treat the condition, but there's no complete cure for it. So it's then trying to look at how can we take the treatment adequately for the adequate duration of time that's needed, because you then think about life without adequate treatment.
Right.
And the extent of functional impairment that it causes, where people are not able to function adequately. So we often focus on functionality. That's the basic, isn't it? For each one of us to be able to function comfortably. We are not even talking about happiness here because that's quite a unique concept.
I
So
know. Yeah. So
it's
it's
trying
about
to think
that, removing that fear. You must be facing this more often in your clinics because you might have seen so many cases, no, ma'am. This must have been one stubborn thing to fight against.
So I think what is really fascinating is things are changing. People's perspective is certainly changing. Psychiatry as a science has come a long way from how it was probably 60 years ago, 70 years ago. There's a lot more that can be done by psychological treatments. There's a medication is a lot different to how it used to be in the past. So the fear that's associated with psychological aspects in people's minds is perhaps um, due to maybe the treatment strategies in the past and the kind of illnesses that people were exposed to, the treatment options. And I worry sometimes that media, in some ways, it's really helpful, where it portrays mental health issues in a slightly different way. But in some cases, it portrays mental health aspects in a negative way, and people get influenced by that. So that becomes a double-edged sword. So and I think now even the media is trying to really understand what it's about. And unless we know something, something which is not known makes us more scared. If we are more aware of things, then that makes it easier for us to manage, doesn't it?
Yes, ma'am. Here's Pooja Thapa's question, 25-year-old female. What helps lower overthinking? And also, there's another registered user's question. How do I reduce stress from family issues? Work bully or family bully or relationship issues bully. There is so much of stress that everybody faces across ages, gender, and the social strata. Everybody now is in one collective stress. So, how do we reduce this overthinking, anxiety, and stress from issues?
Oh, thank you so much. That's a really great questions. Both are. So when we look at overthinking, it's quite a common thing for people to do that. And some people by nature tend to think a lot. So what we find is such individuals are very caring, very affectionate. They are very sensitive individuals. They are all amazing strengths to have. But the flip side of the coin is that they think a lot about things and they worry about things because they care so much about
Okay.
things. So it's them trying to make sense of thoughts as are as powerful as the power we give them. Because thoughts, there are millions of thoughts that we have every day, don't we? And I think it's possible that we've tried really hard. We think, oh, please, please, I don't want to think about this. I really don't want to consider this at this point in time. But we can't help it because they go round and round in circles in our mind, and we kind of are not able to switch it off. So, at in those kind of situations, there are certain self-help strategies that can be tried. Someone earlier spoke about yoga. So, aspects like yoga, exercising on a regular basis, making sure that there is a balanced diet, we have a routine in the day, we give ourselves some time rather than getting too preoccupied just with work and family related aspects. It's making sure that in a small way we find things which are enjoyable, hobbies that we really, really love. Um, it may be anything. It may be craft related, it may be sport related, it may be cycling, it may be walking, anything that gives us happiness or enjoyment. Those kind of aspects is really helpful to kind of think about. Now, when we have done all that and we still feel that it's not possible to shake this off, this is when, so this is where my head as a psychiatrist perhaps comes in. And I think, how long do we keep trying? Do we keep trying? And it's trying to then think about, would it help to just have a consultation with somebody? So once we have tried it for a period of time and it's causing us, you would often hear psychiatrists talk about functional impairment. And what I mean when I say that is, if it's getting in the way of us functioning on a day to day basis, if it's interfering with our sleep, if it's interfering with our appetite, if we are not able to, we think we are capable of doing a lot more and we are not able to focus at work. Our attention is not great, our concentration is not great. Things which we normally do so easily, it takes us hours to finish. Those are aspects which I would say is significant functional impairment. Then I think that's the time where we say, okay, I've tried this on my own, now I need to seek help. The
Wonderful.
other
And do not
important
hesitate. Yeah. Do not hesitate when one has reached to that point.
Wonderfully, wonderfully. And I think the other important point to remember is not to fight our thoughts. So thoughts are thoughts, so let's not battle them. So when a thought comes in, it's trying to think about, okay, thought, it's a difficult thought, it's a negative thought, and we say, okay, you're back again. That's okay. I'm happy for you to be there, but I'm still going to carry on doing this. Yeah, so it's almost trying to acknowledge the thought and then not fighting it. When we
And
fight
this
it,
is
it becomes
this requires practice, conscious practice. एक बार करते हैं, one time that you have tried telling this is not going to happen. This is going to have, you need to go have practice, have patience, and then continue doing this. Wonderful, ma'am. Ma'am, quickly, before we run out of time, two more questions that I would want to take from the audience, ma'am. Mr. PHNISM2, I didn't get your name, age, gender. Please do type back with name, age, or age, gender. And your question is not very clear. What is dread subconsciously? So your question is not clear. We would want to take up your question. Do type again. In the meanwhile, ma'am, Dhanu is asking, hello, Dr. Shrilaxmi. I hope you're doing really very well. I'm a male, 28-year-old. My RBC recently results were absolutely normal, but I still feel dizzy most of the times. As a young adult, 28-year-old.
Thank you so much for giving us that information. And I just want to say, a big thank you to everybody who has presented questions, because these are quite personal questions which you have been so kind enough to share in order
You
to
know,
think about.
right,
Um,
right. Very important, ma'am. These are very important issues that you might not want to share on a public platform, but people have come forward and I appreciate them.
Definitely, definitely. So, with regard to what you've just said, sorry, this is where my head as a psychiatrist comes in. Yeah, the kind of things that I would be checking on would be, how is your blood pressure? Are your blood sugars okay? Is your blood pressure okay? Those are the basic things that we'll check out. And we'd also try and think about whether you're eating regularly, whether you're drinking enough through the day. Are you drinking enough fluids? Are you eating regularly through the day? Are you missing meals? Are you skipping meals? Those are all basic things we try and understand. We also
Yeah.
try and think about the level of exercise that a person is doing. Are you an athlete? So sometimes that also influences certain patterns within the heart and the brain. So we try and understand all this. So if all that is okay, so it might be worthwhile just checking all that out. If all
Yes.
that is okay and still the person is feeling dizzy, it may be worthwhile just trying to make sense of, is there something stressful that's going on in their life at this point in time? Is there something they'd like to make sense of? And I think sometimes we talk about journaling. I don't know whether people have heard of this
Yes.
term. So,
Writing down details into one diary, keeping a journal of thoughts. Yes, so that'll help. Journaling is always a good thing to do. And doctor, I think you have
I'm
placed it
so
well.
sorry.
One problem. Yeah.
Um,
Yes, in the meanwhile, PHN, ISN2, a male 35-year-old going through continuous worry subconsciously. Okay, we got your question. We will place it before doctor. Yes, Dr. Shrilaxmi, you're back with us. So PHN has replied here. He's a male 35-year-old who's going through continuous worry subconsciously. It's going underneath. It's being very tough to have awareness of it. How can we get rid of this? See, once this is an important aspect where I address it, where it is visible, I'm able to see it. And if it is subconscious and it is still affecting, it is important. How do we address such things?
Absolutely, absolutely. Thank you for sharing that again with us. Really helpful. So, when we are aware of certain things, it becomes a lot easier to manage it because we are aware of it and we can work through it. But I think when we are unaware, that becomes quite a challenge. Um, and I think that requires a little bit of help. I'm a big fan of self-help strategies. I'm always think about when, rather than people thinking, we have to go to a medic for anything, we have to seek help for anything. That's not it at all. There is a lot that people can do on their own. Support from family, support from friends is absolutely amazing. But there are certain situations where it really helps to seek help, and I think something that might take a lot longer might get resolved in a slightly more quicker pace, at a
Yeah.
slightly more quicker pace. And it's trying to think about it that way. And I think, again, this is where my professional background comes in, and I'm thinking there's so much more I'd like to understand from this
It is not
person. So
enough,
it might
not the
be
right platform. Yes, ma'am. We will leave a description of your link in the description box so that they can consult you. Ma'am, I'm running short of time, so I
oh,
have two more important questions, ma'am. So I request you to kindly shorten the answers and address as much as possible, ma'am. Manish Sharma ji is asking, what is CBT, cognitive behavioral therapy, and how does it help somebody? So I know it's a larger topic, but if you could quickly give us a subject intro.
absolutely, absolutely. Thank you. Say if I am depressed. So if we think about me being depressed, so the kind of thoughts that I might have, my mood may be very low. the kind of thoughts that I might have is, I'm a rubbish doctor, I'm a rubbish friend, I'm not going to be able to help anybody. So, and as a consequence, I might stop coming into work, I might stop meeting up with my friends. So, three different aspects we are looking at. One is cognitions or thoughts, the other is my mood, and the third is my actions, my
Yeah.
behavior. So, what cognitive behavior therapy does is it tries to understand the link between all these three, tries to make sense of that, and then it's trying to make small different changes, trying to understand, and that helps shift things. And what is amazing is research has shown that cognitive behavior therapy on its own has caused significant brain level changes. You may think, oh, this is just talking. How can this influence brain chemicals? This influences structure and function within the brain so that the anxiety and mood related symptoms change. So it's absolutely phenomenal. It's a treatment which really, really helps.
Wonderful, wonderful. So very well and simply explained, ma'am. One last question. Did COVID do something with our mental health scenario? Because I see two of our very regular audience interacting on the platform. Ramya is asking brain fog, memory loss, inactiveness. Are these COVID side effects? And Mr. Manish Sharma says COVID has no relation to psychosomatic diseases. Or while there are two different things, has COVID left us with any kind of mental health issues, stress, anxiety disorders?
Definitely, definitely, without a doubt, without a doubt. So there's a recognized entity called long COVID. So this is from a purely medical point of view. I'll come to the psychosocial point of view subsequently. From a medical perspective, those who have had COVID, those who have had COVID, have features suggestive of long COVID, which then presents with significant emotional health difficulties as well as, like you were describing, brain fog, tiredness, listlessness, not lack of motivation, lack of energy. So all these can be features of long COVID, and it's completely so. Research is still ongoing in this regard. So it might be helpful to please do seek help because it's treatable. It's completely
Nice.
treatable. Um, and with slightly the broader picture, because it was so different to what we are used to from a social point of view, we've had a 3 or 4-fold increase in mental health referrals post COVID. And this is
Oh,
across the world. So I was during COVID. I was working in the UK, and now I've moved to Chennai. And I think even in the UK, we found we had a 4-fold increase in the number of children and young people being referred to mental health services following COVID. And
all
we have seen this in Chennai as well. So this is not something that's different.
all right. Ma'am, thank you so much. And one quick last question. It's not a question, but I would want you to throw light on, can children also have psychosomatic issues without any other reasons? Can they also have pain in the stomach, legs, or dizziness, headaches?
But thank you for that question. So it's more common in children and young people than it is in adults, fascinatingly. So because the reason being, children and young people don't have adequate emotional language. So this is where we say, as part of parenting, this is again part of our culture where we say, we pull up our socks and get on with it. What I suggest is, please let's pay attention to emotions. The more we help children articulate, the more we are in touch with our own emotions and articulate them. We teach our children that that's fine to express how we feel, to talk about how we feel, so that they have that emotional language which develops as well. So it is completely possible and it is incredibly treatable. There's children and young people respond much better to treatment.
Absolutely beautiful, ma'am. Because half the time we don't identify the issues, and once you've identified, you should come to a proper channel which can help you, the professional who can help you. Thank you, Dr. Srilaxmi Velandi, for your time on this Sunday morning. Absolutely a pleasure having you on the show, ma'am.
Thank you so much. It's been so a great week here. Thank you.
Thank you, ma'am. Namaskar. So coming up is a health quiz. and Dr. Shrilaxmi will lead now, and your chance of answering my questions on the show. Please do type in your answers on YouTube chat only. I'm going to ask you 3 questions now. Winner's name will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And if I take your name to be the winner, please do write back with all your contact details at marketing@apollo247.com. Gift vouchers those are health credits will be shared with you very soon. And if you have any issues with our earlier health credits, do write back to us. We shall make sure that your health credits are credited. Here are the 3 questions for our health quiz this week. Fill in the blanks. STR-S- is one of the most common causes of psychosomatic disorders. What is the word? Fill in the blanks there and make it a word. STR-S- is one of the most common causes of psychosomatic disorders. Question number 2, yes or no? Your emotions can impact your health. Is that true or false? Please do state yes or no. Question number 3 is true or false? Psychosomatic disorders are imaginary. True or false? These are the 3 questions. Please go ahead, type your answers in YouTube, and in the meanwhile, we are going to give you gift vouchers. Here are the gift vouchers which you can use on Apollo 24/7. Download the app. Entire Apollo आपके हाथ में आ जाएगा, and you can use these coupons to get further discounts as well. Use the code ASKDOC150, AskDoc150, and you get 150 rupees cash back on online doctor consultation, and top doctors are available on Apollo 24/7 platform. And the next coupon that we give away is here. First 3, use the code FIRST3. Order medicines direct from Apollo and get up to 25% off on online medicines. This is valid on the first 3 medicine orders which are above 1000 rupees of cost. And you also get a 2-hour delivery as well when you order from Apollo 24/7. Health Hour viewers, here's the coupon that is exclusive for the Health Hour viewers. Use the code HH247. You get 199 off on online consultation with Apollo doctors and 20% off on medicine orders. This coupon can be used in addition to the other coupons that I had given away a little while ago. Also, let me tell you all that Apollo 24/7 is now on WhatsApp. Also, now you can call or WhatsApp on 9355247247 to avail healthcare services, which is very simple. Apollo 24/7 can be accessed through WhatsApp. Save the number. Next week, by the way, it's a very, very interesting topic and very, very useful topic that we're going to talk about. Knee pain. घुटनों में दर्द के बारे में बात करने वाले हैं. मोकाल नोपलू. Home remedies, physical therapies, surgeries, what are the new treatments, what are the options that are available. So everything regarding knee pain we are going to talk about on 6th of August, 11 a.m. next Sunday. Do join us. As Dr. Shrilaxmi was mentioning, it's very important and it takes a lot of courage to show up on such public platforms to actually ask questions and then bring up answers for everybody. So do join us and ask your questions because your question is answer to many. And आज के winners मैं announce करने वाली हूँ Mr. Shankar, Kavita and Suresh KR. I repeat, the winners are Shankar, Kavita, Suresh KR. Please write back to us at marketing@apollo247.com to claim your gifts. Thank you all for joining us today. See you next week. Namaskar.